thank you very much, Monica. So just to introduce, my name is Pavin Zaveri. I'm a pediatric emergency medicine physician by practice at Children's National Hospital in Washington, D.C. in the USA, and serve as one of the co-chairs of the IPSS Spring Symposium, Simulation Transforming Safety. So just kind of giving the overview, as you can see up there, and Monica alluded to it already, that this symposium is subtitled Simulation Transforming Safety. And the main gist of this has been really thinking about the evolution of where we're at. As you all are very familiar, simulation has matured quite a bit over the past couple decades. And not just in all hospitals and schools, but also in children's hospitals. And that's really was originally the source of community that IPSS found and formed to really be able to bring our folks together, acknowledging the many different aspects of simulation that pediatric facilities or children's hospitals deal with, as well as many of the unique aspects of pediatric simulation. And so IPSS definitely has been providing to those audiences, those members who are looking to develop their pediatric simulation expertise, as well as refine what they're delivering. And in that sense, where, as Monica shared, we have a number of experts, as well as about half of our sessions at our general conference often focused on the novice simulationist, or maybe even more. And really, we wanted to use the opportunity to deliver a symposium acknowledging that there are many people who are well beyond novice at the competent or even expert pediatric simulationist. And how do we re-engage them and engage them for a healthy dialogue on how do we take it to a new level? And so the two main topics that emanated out of our IPSS V workshops in October of 2020 was a concept to discuss Safety 2. And Safety 2 is a concept that's been out there for over a decade, but is still working on trying to develop mainstream integration. And for just a brief line about Safety 2. So Safety 1 is the typical concept of root cause analysis. When an error happens, what went wrong? And what Safety 2 does is flip the question and try to look at things that went well, including near misses, and what went well. What did we do right? What was the expertise? What was the capacity, the resilience that allowed this success to occur? And that's really the driver of Safety 2 as a concept. And what we're going to be doing, and first I'm going to have Ingrid talk about our two keynote speakers and how we tie in these concepts into what they're going to be presenting.
Our first keynote speaker, Dr. Carl Horsley, is an intensivist with a background in emergency medicine. He is out in New Zealand. He actually is also active on the Health Quality and Safety Commission in New Zealand currently, and is an expert in Safety 2 and resilience in healthcare systems. As Pavin had already alluded to, with Safety 2, the focus is not just on how do you avoid bad things happening, which is sort of an oversimplification of safety or Safety 1. But with Safety 2, you're trying to understand why do things go right, or why do things happen any number of different ways, so that you can encourage the things that go the right way to happen more. So not just avoiding bad things, but actually trying to understand and create at a system level the good and the safe things to continue happening. He has done quite a lot of work on this, and we're really excited that he's going to be able to talk to us about this at the conference. So we won't plot spoil and tell all of it, but for those of you who haven't done much for Safety 2, or even if you have, it's going to have keynote initially where he's speaking, and then they'll break into smaller workshops that will really be able to take the deep dive on some of the topics of interest.
Over from there. So as Ingrid was saying, after the keynote, we'll be having 4 workshops, and just to give a sampling of the different workshops that are going to be there, we'll be having ones on cultivating resilience in healthcare. There will be a workshop on the psychological safety, applying these principles that we use in simulation to transition to the healthcare setting, and how do we create those safe spaces to discuss what needs to go right to prevent errors, to ensure safety. We're going to be talking about interwoven simulation and the blending of simulation with our regular healthcare delivery to make sure that we're able to provide the best situations, the best, safest care possible, not just in our simulated sense, but also in the actual sense. And the other one will be about bridging the gap between work as imagined and work as done. Oftentimes when we plan something, we plan to the best, and we imagine that it's going to go this way. It doesn't quite work out that way. Why is there that gap? What does happen there? And what's interesting in this, and Ellen Deutsch has written a nice article on this that you could find on when you look at work as imagined versus work as done, about these other concepts of work as simulated, work as theorized, work as abstracted, work as observed, and look at why are there so many gaps between all of these spaces, and how do we try to harmonize that? The next element of the second couple hours of the symposium will be starting with a keynote by Andrew Fraschosniak, who is a emergency medicine physician from St. Michael's Hospital and University of Toronto, but has really developed quite a career in design thinking. So many of you probably already use or have considered using or have learned about using simulation for systems testing. And, and there has been quite a bit published on that, and people have incorporated it from helping hospitals design new and schools design new spaces, redesign spaces, and at various phases. What Andrew's going to be doing is actually looking at it from the lens of design thinking, and going to go over what that concept is, and it basically adds a whole new level to the systems testing and really helps think about the stakeholders, the concepts to embed from the get-go. And following that will be a few workshops where it'll actually be a practical element, where we're going to have several people engaging with the facilitator and going through an exercise applying the principles of design thinking. And following each of these elements, there will be a brief breakout report out by the facilitators, because as happens with most workshops and conferences of this nature, you only get to go to a couple out of the 3 or 4 workshops, and you want to know what happened elsewhere. You feel like you missed out. And so we thought we should offer a report out by the facilitators to be able to give that opportunity, and then also a Q&A with the keynote speaker. And so those are the elements that we have put together for this the Spring Symposium on Simulation Transforming Safety. And again, as you can see there, it's going to be on May 19th from 1 p.m. to 7 p.m. Eastern Daylight Time, with a great opportunity for networking and learning about how we're going to take simulation to the next level.
Yeah, sure, go ahead.
So as I was speaking through these, you guys may have noticed that actually the content isn't pediatric specific. This is about general simulation. This is about what we do. And that's why, as you can see in the pricing for the members, even the non-members, we really are inviting and encouraging our non-members to come and see what the IPSS community is about. But even if not joining to be a member, but to engaging in this conversation where we're looking at providing an advanced level of discussion and providing a community to foster that discussion. And so really do invite our folks that may be more involved in the human factors aspects of simulation, in global simulation, and low resource simulation, to come and join with us because of the broad nature of what we're talking about.